We are back here at the Fraum Center with our friend Dr. H. It is wonderful to see you. I feel so privileged to be sitting in this office with you. It's a treat. It really is.
Yeah.
I have some basic questions I'd love to ask you in this segment. I'd like to talk a little bit about restorative medicine and what that really is.
Yeah, absolutely. So restorative medicine, the underpinning of the whole philosophy is that we would have the best possible outcome if our body fixed whatever is going wrong.
Okay.
Because even with 150 plus years of Western medicine, it's nowhere near as smart as our bodies are. And so, you know, when we start to intervene on things with, you know, big medications and surgery, it's never going to be as good as our body could do if it had the right tools.
And that actually makes sense to me. That would be an option of last resort.
Yeah.
So from a restorative medicine point of view, what then would the alternatives be? For example.
Okay, like alternative options within restorative medicine.
Exactly.
Okay. Well, the neat thing about a philosophy that broad is that whatever will do the trick, whatever will get the body to heal itself again, is on the table.
Okay.
And so that keeps our options open in terms of technologies, modalities, and drugs, you know, drug possibilities to help trigger those things.
Well, let's talk a little bit about then what brings me into you?
You know, that's a very broad question. Yes, yes.
Well, because we're talking restorative health, and I'm thinking proactive,
yes,
as opposed to reactive.
Yes.
What brings me to you?
So, a lot of people that come to me for proactive health are in a phase of their life where they're considering what they want their life to look like.
Okay.
And how they want to be active, and you know, maybe they've just retired and want to do all the things that they love to do. You know, the golf, the pickleball, like all the things. They've got the house they want to travel, and they realize that, you know, I'm going to need to do some things if I want to maintain this lifestyle across my lifetime.
Okay.
And so that is often a big trigger point for patients coming to see us for proactive care.
Now, in the flip side, reactive. I'm now not feeling good. I'm a little bit achy. This hurts, that hurts.
Yeah, you know, that's when there's some part of the body that is really malfunctioning, right? Whether it's a joint that you're having trouble using, you've started to make significant changes to what you do on a daily basis, or if it's neuropathy, like, you know, you start to realize, you know, you don't know where the ground is based on what your feet are telling you. You know, there's a lot of things, but something is impeding somebody's basic life.
So quality of life has gone down.
Yes.
Once I feel that, maybe I don't really even know what's going on. I just know I just don't feel well. That's the time I come and see you.
Yes.
What would an assessment look like then?
Well, obviously the big question is what brings you to see me, right?
Okay, right.
You know, and then it's digging down. And honestly, the thing that I have to know with all of my patients is, where do they want to be?
Ah, okay.
So where do you want to be? And what is the thing that you're missing out on right now that is concerning you, that is limiting your quality of life? So, you know, getting people knowing what those goals are, that really helps me tailor the patient's care plan to them, is knowing where they want to be and what they're inhibited from doing right now.
I find that to be really inspirational. It's less about, I come in with my knee, okay, we'll fix your knee. It's more like, well, Debbie, where do you want to be now? Well, I want to be able to play with my grandkids.
Right.
Okay.
Right.
Let's go from there.
Absolutely. I mean, it could be, hey, my knee hurts, Debbie, you know, we got to do this surgery to fix that. But maybe the thing that you value is not having the 6 months of downtime and all the other things that come afterwards. So if I don't know that about you, I don't have a great, you know, I don't have a full picture if I don't know, you know, what you value and where you want to be.
So what I hear you really say is, from an intake point of view, really getting to know, developing a relationship with your patient, that's foremost for you.
Absolutely.
Every time we talk, I learn something.
Oh, thank you.
We're going to talk again.
Okay.
So stay with us. We'll be back.